India is the world's biggest vaccine maker, but days of record-breaking COVID-19 infections have forced it to delay exports. Its hospitals are under strain and cases are rising. So, how will the government bring it under control? This is Inside Story. Hello and welcome to the program. I'm Mohammed Jamjoom. Just a month ago, India declared an endgame to the pandemic. COVID-19 infections were falling. The health minister heaped praise on the prime minister as well as the export of vaccines to developing nations. But now, the world's second biggest population is recording nearly 300,000 new cases every day. That's more than during the first wave of infections last year. Hospitals are buckling under the pressure. The region around its capital, New Delhi, is going into a week-long curfew. Scientists say mass gatherings are fueling the spread of a new, more infectious variant. We'll bring in our guests in a moment. First, this update from Victoria Gatenby.
India is in the grip of a second wave of COVID-19, and nowhere is that being felt more than in its hospitals. There are shortages of beds, oxygen supplies and medicine, and doctors say this time they've seen a change in who is being admitted to hospital.
What we are seeing, and this is all anecdotal or personal experience, is there are younger patients who are being admitted into hospital and are more sick than the type of disease that young patients usually have, which is mild to moderate.
Like many Indian states, Delhi has been recording its highest number of cases since the pandemic began. Its leader has announced new restrictions for the capital's 30 million people.
We don't want to take Delhi to a place where patients are lying in hospital corridors and people are dying on roads. After carefully considering and analyzing the situation, your government feels it is important to impose a lockdown in Delhi for 6 days.
India reported 275,000 new cases on Monday. That's the highest daily tally in a country that's now the second worst affected in the world. Scientists say a new variant with a double mutation may be driving up infections.
In most cases, we've only seen one area of the virus mutating from the original virus. In this case, we have two separate mutation sites, which is really concerning because, as you know, every time that we have a mutation, we're worried about increased transmissibility, increased threat of death, and a lack of ability of our vaccines to work.
Despite the rise in cases, political and religious gatherings are continuing in many places. Last week, 3 million Hindu pilgrims bathed in the Ganges River for the Kumbh Mela festival, and millions more voted in local elections in the state of Uttar Pradesh.
I think the guard was let down not just by Indians, but by Indian leaders. Massive election rallies were held, and subsequently the massive Hindu festival of Kumbh, all are contributing towards this massive surge.
In the city of Ghaziabad, the crematoriums are full, so some families had to cremate their relatives on the street. And with a new variant with a double mutation to contend with, India faces many more difficult days ahead. Victoria Gatenby for Inside Story.
With only 1% of India's population fully vaccinated against COVID-19, the government is limiting vaccine exports. The Serum Institute of India is the world's largest vaccine maker. It's delayed the shipment of millions of doses to COVAX, the UN-backed global initiative to deliver jabs to lower and middle-income countries. The Institute's CEO has urged the U.S. to lift the embargo on exporting raw materials so it can ramp up production. The Indian government is now rushing to import vaccines. All right, let's bring in our guests. In Puducherry, India, T. Sundararaman, a global coordinator for the People's Health Movement and professor at the School of Health System Studies at the TATA Institute of Social Sciences. In Gangtok, India, Deepsikha Chettri, a medical doctor and member of UNESCO's International Bioethics Committee. And here in Doha, Uday Chandra, assistant professor of government at Georgetown University. A warm welcome to you all. Deepsikha, let me start with you today. How do we know if the new double mutation coronavirus in India might be behind this fueling of the record surge of cases in the country. Could that, in fact, be the case?
Yes, of course. I mean, we speak from statistics and our observation, and we have observed in the past 1 month or so that the transmission has increased rampantly. The new strain has so many variations in itself. I mean, if you just speculate, the population which it affects is the younger generation. And if you look at it from a more common sense point of view, the younger population is the population that mobilizes more as compared to the older dividend, which the previous strain affected more commonly. So that is one of the contributory factors. Also, the new strain, as of now, we are observing that it is not fully detected on RT-PCR tests as well. The S mutation of it, if it tends to get dropped off, and we tend to even miss it on RT-PCR tests. So, of course, this mutation in the genetic realms of this virus does play a role in the rather, escalated rampant transmission in the current second wave scenario. Of course, yes.
Uday, I saw you nodding quite a bit to what Deepsikha was saying there. Did you want to jump in and add to it?
Yeah, I don't think the Indian government is very keen to own up to the fact that there is an Indian variant now after the South African or the UK or the Brazilian variants. And so it's a kind of case of vaccine nationalism gone wrong. And I think that's a cause of great concern now.
Dr. Sundararaman, how close is the health system in India to a breaking point at this stage?
Oh, it is really very stressed. Some of the southern states, some of the better performing health systems from earlier times who did face the brunt in the first wave are relatively better prepared. You can make that out by less crisis on the oxygen front. But some of the large Hindi-speaking states where the wave has hit the big way for the first time, getting more than 10,000 numbers per day, they are really reeling because their hospital capacities were underwhelmed even earlier, and now there is an overwhelming infection. They are hardly able to cope. I'm not going to attribute all of this to the mutant, which is to some extent in some areas. You can see that in some of the states, this mutant has not made its presence, but the second wave has made its presence. So the mutant is one factor, but there is also a general factor about very weak public health management and a failed anticipation of a second wave, a certain relaxation of our guard in between, a lack of preparation. Last October, the government had announced that they were going to strengthen 160 hospitals in these very states and districts for being able to supply piped oxygen internally. Not even 10% as this. It started in October and then the whole effort relaxed off because the cases started dropping. And now we are rushing again to catch up with that because of that particular trough that we had between November and March. We could have used for better preparation, but I'm afraid we did not. And there was a certain degree of complacency, a premature gratification that was a problem.
Deepsikha, let me ask you, India has pledged to raise monthly production of its own COVID-19 vaccine about tenfold to nearly 100 million doses by September. Given what you're seeing now of the severe shortage of the vaccine in India, is that even possible?
Yes, about the vaccine production, I'm not worried as much as I'm worried about the transmission and the morbidity and mortality associated with the second wave, because we were, as it is, the highest crossing number of mass producers of vaccine. It's just that the lull and the complacent period, it affected the entire COVID scenario, be it the precautionary measures or the vaccine production measures. Also, initially, we were rampantly exporting vaccines. Now, with the curtailment of the same and also the emergency approval of the Sputnik V vaccine, which is going to start its mass productions in India by the end of this month, and also going by the statistics that we have, I think, till date, vaccinated, that means also produced more than 120 million vaccine doses. Vaccine production is not going to be an issue. Of course, it will be difficult, but it is a very attainable and possible dream. So at this point, as I again lay focus that I'm more concerned and, worried about this mortality and morbidity of the second wave than the vaccine production.
Uday, while all this is going on, of course, and while infections are soaring throughout the country, politicians are continuing to hold huge rallies across the country for these state elections. I mean, is the government not worried that this could make things much worse?
I really think that they've been caught napping. They've been caught, unawares. They really did think that between November and March, when the second wave started, they really relaxed. They didn't make the preparations that they should have over winter. And I think we're seeing that now that they thought that they'd go ahead with a regular election campaign, which really isn't very realistic by any kind of account. But clearly the Modi government thought it could get away. Modi had a very busy election calendar in March and April, and he was planning to continue. And my general sense is that the government conveyed a sense of complacency. So it is ultimately culpable for people also taking the situation very casually.
Dr. Sundararaman, how concerning is it for you to see that these massive political rallies and the religious festivals are ongoing throughout the country at such a time, at such a dire time when it comes to the pandemic?
It's really a terrible scenario to watch. We should have been more careful. But I want to take you back to that question on vaccines, because I would not be so sanguine about our manufacturing capacity. We were the world's largest vaccine supplier, but today we are supplying about 2.3 million doses per day. It's a big amount, but we are deploying close to 4 million doses per day. And at this rate, we will be running out of vaccines very soon, when actually we need to ramp up deployment from the current 4 million doses per day to 10 million doses per day if we have to do anything about aborting a third wave, let alone be in time for the second wave. So we are far behind our production schedule. The government, the Serum Institute of India has asked for 3,500 crores of public financing. So has Bharat Biotech asked for being able to double its supply to reach that 100 million doses, which they also have been overconfidently promising earlier. Government is also licensing 6 more companies to start up manufacturing production and using its own, this COVAXin, which is an indigenous vaccine, to give them. But for all of this to happen, for either Serum Institute to start production or these 6 institutes to start production, is going to take close to 3 months. And therefore, the whole of the heart of the second wave will cross. That's the reason why we, the greatest exporter, have now gone into imports. But even in this import deal, a lot of it has to be manufactured by Reddy Labs in India and by other things. And therefore, the stepping up of manufacture and its regulation is an issue. New vaccine innovation is also a real problem. And the whole transfer of technology, unless there is a much greater waiver of the patent requirements, as the India and South African government have pushed forward at the WTO platform to ask for a complete waiver of this, we are not going to be able to meet our vaccine targets. And remember the huge inequity of this, because some countries like the US and the European Union.
Dr. Sundararaman, I'm sorry to interrupt you, but I want to get back to actually something you're mentioning now in just a few moments. I want to actually ask now Deepsikha to expand on a point that you were making, because you were talking about the Serum Institute of India. Deepsikha, of course, the Serum Institute of India is the world's largest maker of vaccines, and the head of the Serum Institute of India has asked U.S. President Joe Biden on Twitter to lift the U.S. embargo on exporting raw materials needed to make COVID-19 vaccines. The EU has also tightened restrictions around vaccine imports. How much is all of that having an impact on the manufacturing of vaccines in India?
Of course, it has a huge impact. I mean, the embargo in itself, right now, if at this point it is lifted up, it is going to play a huge role in helping us and aiding us to ramp up the production of vaccines. And I think that is the plain reasons as why he chose to tweet about such a sensitive topic. And I think even Biden was, he should realize that at this juncture, we should keep aside our political differences and help each other in combating this pandemic. Because, outsourcing and insourcing raw materials from these places where embargo has been implemented is really going to help us enhance our production. We, as Dr. Sundar mentioned, we by September, that's good 3 months from now. I said I'm not worried about the vaccine production. I'm worried more about the transmission. But that doesn't, defy the fact that we need to ramp up the vaccine production as well. And right now we are vaccinating 45 years and older with comorbidities and the frontline workers. But as I mentioned before, the current strain that is transmitting in India affects the younger population more as per the recent trends and statistical observation. So now we need to shift our focus and not completely be oblivious of this young population as well, because this vaccine has been, this virus has been affecting the younger population with as much aggression as was the previous vaccine virus affecting the older population. We see people with direct, very significant radiological changes and people requiring oxygen and ventilators much more. And this is a young population we are talking about. And during this entire vaccination campaign, the young population has been absolutely sidelined because we were following the trend of the previous virus. And now we need to update the trend of the vaccine also accordingly. So of course that means more requirement of vaccine production is directly proportional to the requirement of raw materials, which of course is again directly proportional to the embargoes lifted off of these places so that we can get these raw materials from this. So yes, it is a very valid and significant point which the powerful first world nation in view of the greater good should really consider.
Uday, the fact that that in India right now, when it comes to COVID-19 vaccines, we're talking more about imports than exports. I mean, the fact that the government has taken action to open the doors for vaccine imports and to fast-track emergency approvals for other vaccines like Moderna, Johnson & Johnson, possibly Pfizer, does that speak to how much pressure the government is under right now to try to turn things around?
Yeah, I mean, this government primarily deals with big public policy questions through headline management and tweeting. So this whole approach to public policy has been exposed now because, of course, it's not just this government. Previous governments haven't built the healthcare infrastructure, and now we are kind of reaping what has been sown in the past. What this government is actually doing, it actually did not enter into agreements with Moderna, Pfizer, even Sputnik for that matter, right? And now we have a situation where there's this emergency approval for Sputnik. There are probably going to be other foreign vaccines as well as all the different private initiatives in India. But it just seems like bolting the stable door after the horse has fled. It seems too little too late at this point. And so you can see that headline management comes across as not the best way of implementing public health policy.
Dr. Sundararaman, how big a problem in India is the issue of vaccine hesitancy, and has it so far played a significant role when it comes to the very sluggish vaccine rollout throughout the country?
So I think this is also a very important question. And by vaccine hesitancy, what one means is a refusal or a reluctance to take vaccination. India's first problem is not that. It's a certain type of vaccine access and awareness. The more vulnerable people are, the more at risk. The sanitation worker, the fish vendor, the vegetable vendors, the less likely they are to have a health-seeking behavior where they go and get themselves vaccinated. So usually we have strong public health outreach programs that reach the vulnerable. But here, because of this, the actual pickup of demand will remain low and the most vulnerable. So it will be a high degree of inequity if you leave it to people to come and get vaccine through that registration process. That's the number one problem. There is a problem of vaccine hesitancy because of a high degree of stigmatization and denial, COVID denial that has taken place because of the law and order approach to public health management that we have seen. That really has been a big problem for people coming forward to contact tracing or accepting the whole thing. But to the extent that over here the problem is still a greater problem of requiring an outreach system that will reach out to contract workers, to migrant workers, to construction workers, to people who are at some point going to face much more exposure to the virus. So I think there is a big problem on the demand side also. But because today, at this point of time, vaccine availability is also low, it hasn't yet manifested itself. Otherwise, we should have been seeing overcrowding in the vaccine delivery. We still see it at the public sector deliveries in many places, but nowhere near the range of pressure that should develop, even in the 45 above. And as my earlier speaker correctly said, there is a need to expand to a lower age group, but we have no wherewithal to do it. We have been correctly put earlier, headline managing rather than at some point pandemic management.
Deepsikha, the Indian government has announced that all adult Indians will be eligible for the COVID-19 vaccine from May. Do you foresee that this will significantly change the course of things in India? Will this really change how things are going right now?
Well, as much as this is the need of the hour, I will not agree that it will significantly change the course, because the vaccination, once again, I would like to say it out on international television that getting your 2 shots of COVID vaccine will not make you a superhero. You can still contract the virus, you can still transmit it. And in a place like India, where the vaccine coverage is going to be very limited in the beginning, irrespective of the population. Okay, the outreach programs need to be really, really vibrant and rampant in order to cover the entire population. So even, let's say, for example, a person is vaccinated and then he gets the asymptomatic infection, all the more likely that he can transmit it to other non-vaccinated people. And considering the level of low awareness that is prevailing in the country right now, more than half of the population is believing that once they get their 2 shots of COVID vaccine, they are superheroes. So unless this awareness is spread vociferously and a great vaccination drive is conducted covering all the economic strata of the population, I do not see it making any significant changes. But yes, in the lives of people who are vaccinated, they will be saved from contracting the serious manifestations of the illness, yes. But if I talk about the entire expanse and realm of the disease on a very huge level, no, it will not.
Uday, is the government in India taking steps to expand local production capacity? And if so, what are they doing?
I think that one of the panelists mentioned the law and order approach, and that you see it with the lockdowns or partial lockdowns at different points. The focus of the government now is to leave issues of production to the private sector or to multinational corporations like Pfizer and Moderna. And so the government, yes, has created this vaccine and it wants to work with the private sector, but it is not in some ways the main player when it comes to production. It is also unclear how much money it is going to make available to the Serum Institute, for example, and what is feasible given the economic situation in India, the economic impact of COVID. So I think there are a lot of unknowns at this time. And I think the government has really been, after saying for several weeks that it's not going to lower the age requirements, it suddenly decided that in a couple of weeks, anyone who wants a vaccine could get it, regardless of the age. So it seems that the government is kind of making policy on the fly and not based on any demand and supply calculations, and not necessarily based on actual kind of a plan of sorts, which is grounded in the scientific realities we face.
Uday, let me just ask you one quick follow-up question. We only have just about a minute left. What are some of the other big challenges facing the government when it comes to the vaccine shortages?
I think the real issue is that production in the next 3 months is probably going to be ramped up. But as the panelists have mentioned, what's going to happen is by then we would have been with the second wave would kind of have come to an end. And we would enter another phase of the pandemic in India, a very India-specific pandemic would then take shape, where perhaps even the question now is, can we prevent a third wave? I think that is the realistic situation at this point. And of course, at the same time, try to mitigate the second wave as much as possible through aggressive vaccinations, including those brought from outside India.
All right, we've run out of time, so we're going to have to leave the conversation there. Thank you so much to all of our guests, T. Sundararaman, Deepsikha, Chettri, and Uday Chandra. And thank you, too, for watching. You can see this and all of our previous programs again anytime by visiting our website, aljazeera.com, And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Mohammed Jamjoom, and the whole team here, bye for now.